I'm John Marshall. I'm the chair of the Department of Emergency Medicine at Maimonides Medical Center, and I've been here since 2003. There are great doctors at Maimonides, and there are great nurses and a great staff. We have a wonderful ability to provide incredibly high-quality care, but I think what really makes the practice at Maimonides wonderful is the patients we serve, the communities we serve, the population in Brooklyn that really is so different than anywhere else, really almost on the planet. There's a fabric to the community here that I've not personally found in my own experience anywhere else. You know, it's really exciting and it's an honor to be a part of the fabric of the communities that we serve here. I'm originally from Detroit, Michigan. I went to high school in the Detroit area, went to University of Michigan for my undergraduate degree as well as for my medical school. I had the pleasure of spending my first year of residency training in Hawaii and the following 3 years in Colorado, where I did my emergency medicine training. My first position out of residency training was in the United States Air Force. I spent 4 years on active duty, working in a level 1 trauma center teaching hospital in San Antonio, Texas. I learned some important lessons working in the military at that time. I learned lessons about teamwork. I learned lessons about dedication. I learned lessons about how to be a better physician as well. I was sent to Afghanistan 3 weeks after September 11th happened, and spent the first 6 months of that Afghan war, Operation Enduring Freedom, in and around Afghanistan, taking care of patients under austere conditions, learning what it means to care for traumatically injured patients in a different way than we get to see here. I'm very proud of the work I did in the Air Force. I'm very proud of having been in the military and had the opportunity to serve, but I'm equally proud of the work that our folks do, the civilians in the Maimonides Emergency Department do every single day, caring for the patients that we have here. The kind of discipline and the kind of respect and the kind of dedication to quality, I think, is really second to none. You know, a typical patient coming to the emergency department isn't coming there because they want to be there. Right? A typical patient is having a bad day when they come to the ED. It's our job to make sure that we do as good a job as we can, turning that day around and making that experience as good as it can possibly be, despite having to be in an emergency department. The quality of the care at Maimonides is some of the highest quality care that's available in the entire United States. You can go online and look for yourself and see where we sit in terms of the top 10 hospitals in the country. That quality is there because of the dedication of the staff we have and the degree of excellence to which we hold our staff. The emergency department at Maimonides offers the broadest range of services available in any emergency department in New York City. Whether we're talking about services for children, services for pregnant women, whether we're talking about trauma services or heart attack services or stroke services, whether we're talking about services for geriatric patients and our elderly community members, or the newborn who's arrived. We have subspecialists in bedside diagnostics and sonography. We have subspecialists in public health, hospital administration. We have subspecialists in medical education, in simulation. We have subspecialists in pediatric emergency medicine, being the Children's Hospital for Brooklyn. It's important that we have folks who didn't just do a primary residency, but did an additional 3 years on top of that residency, to be the subspecialist ready to take care of a child. That type of subspecialty, that type of dedication, comes through years and years of hard work and a real commitment to the patients, to the population, and to the specialty. We at Maimonides have, I think, been very fortunate in our ability to recruit a great set of physicians, a great set of caring providers, who I would say are top-notch, and I think provide what is arguably the best emergency care available anywhere in the country, or really anywhere in the world. The most important skill a physician can have is really listening. Being able to walk into a room with a patient, being able to hear a patient, to understand what they're going through from that patient's perspective. That's what makes a really great physician. And as important as CAT scans are, and MRIs and ultrasound probes, and being able to do advanced imaging and all of those great things we have at Maimonides, the most important thing is still the human interaction. It's the human touch. The most important thing is being able to communicate and being able to be heard. You know, when I'm a patient, I want to know that my doctor hears me. I want to know that my doctor understands what I'm saying and where I'm coming from. And you know, that's what we want our doctors to do for every one of our patients every single day in any language that they come in.